Get all the paperwork you think you need together. Life insurance, annuities, retirement information, Social Security information. Gathering all of that is daunting in itself, and can take literally months.
It's a conversation no adult child wants to have with their parent. How will you know when it's time to give up your car keys or family home? What are your wishes for when you can no longer live independently? And most importantly, can you afford the life you envision? With a decades-long career in healthcare finance, Dawn Crump knows her way around a medical bill better than most. But she was forced into unfamiliar territory when the time came to find long-term care for her aging mother. She shared her story with me recently, as well as some advice for others in her position. You and I met at an industry conference for healthcare finance. That is your profession. You've had a long career in it, a very successful one. When we met, you didn't really want to talk to me about best practices in billing or patient payment or any of the things that people typically want to talk about at those conferences. You wanted to get into something a little more personal. Can you tell that story?
I spend a lot of time crisscrossing the country to speak on audits and denials and process improvement with different hospital organizations. And I love that, and I'm very passionate about it. But I think at the time that we met, I was at a specific, more crisis moment, given being a caregiver for my mother and trying to navigate the healthcare systems and the healthcare financial systems in order to make sure that she still receives the long-term care she needs. And a little bit of background, my mother is a retired NICU nurse. So, she spent her life and her career taking care of some of the sickest of the sick babies there are. Over the duration of the last 4 to 5 years throughout COVID and everything else, family and myself have taken turns taking care of her, doing the entire transition that a lot of families have to deal with when they have a family member who has dementia or Alzheimer's and is declining. So we went from her living independently and us checking on her and going to appointments with her and becoming her power of attorney so that we could help make those financial decisions early on, as well as just making doctor's appointments, taking her to visit. So that felt like the easier part, but it was still something that takes time. And then now we have moved into a memory care situation. She can no longer live with any of us. We have exhausted all of her retirement funds, all of her savings. And so now we're going through the process of applying for Medicaid.
Your mother had a good job. She had retirement savings. She did all the right things. Is all of that planning for nothing?
I think the moral of it is, even with the best laid plans, you might exhaust your funds. Those rates are only going to go up. I mean, there's a lot of policy going around long-term care, providing caregivers, being able to fund your 401k if you have to, with catch-ups, if you have to take time off. There's a lot of things that are going into place to try to help you in some respects. But I think we need more. I think that's what it comes down to. There needs to be more policy, more support from employers, more education around different programs to help with in-home care and supporting those caregivers. Even from an employment status, I think I read a stat that to like 61% of caregivers have negative effects on their employment because they're taking care of it. And I can totally see that. And, we had a little blip in time where we were moving my mother from an assisted living to a memory care unit. So I had about 2 weeks where she stayed with me. Now, she had progressed significantly in that time and required a lot more hands-on care. And just those 2 weeks was enough for me to definitely have some mental fatigue, physical fatigue. Luckily, I have a great support, a great organization that I work for that was extremely supportive during that time. But there were certainly times when I would be on a call or a webinar and had to really hang up quickly because there were situations that had to be taken care of. And so even with the advantages of remote work, it's a challenge. It's a financial challenge, it's a mental challenge, and it is a physical challenge. I don't think I slept for 2 weeks.
So I want to get into talking about long-term care specifically, because that is an area of the industry that also has some big challenges, right? I read a statistic this morning that it was 87% of nursing homes have moderate to high levels of staffing shortages. When you hear that, it doesn't really inspire confidence, right? It makes you a little worried about, where am I going to put my beloved parent? How do you navigate the personal, knowing that the organizations you're dealing with also have some big challenges?
They're definitely there, and I've seen that evidence of it. And I think, navigating it from experience is just to some extent trying to look around when you go in, if you're reviewing and interviewing long-term care facilities. Even with that, things change. Things change from where my mother was when, the first place we put her, and then moving homes is really not for the faint of heart. So you want to find a place that meets your basic needs, even with the short staff. And I feel for the staff members at that point as well, even with the short staff does not mean that they don't care, and they're not trying their best to provide the best care possible. Mm-hmm. But that being said, trying to support them when you go in and being an engaged family member, if possible. But if something's bothering you, you want to clean up their room when you go out there, then clean up their room. Just little things like that, I think make a difference. And then we really try to, get to know the staff a little bit when we're out there. And it always does my heart good when I'm out there and they see me talking with mom, or even there's times I'll be walking down the hallway and I won't necessarily know who that nurse is, or they're on another unit, but they'll be like, "Oh, you're Flo's daughter. I can see the resemblance." So that means that they know my parent, right? They know my mom. Yeah. They know her enough to be able to recognize me as I'm walking through. So those things matter.
You had talked a little bit about Medicaid and the Medicaid application, and people might be listening and saying, I don't need to worry about Medicaid. I've got Medicare. I've got great coverage. What should they know?
Well, I think that's a great point. And Medicare and managed care can provide great coverage for your overall care. But what it doesn't cover is long-term care in most situations, right? And especially in these longer-term memory care type situations. And so you can't depend on that. You can't depend on that even if it's a perk from your retirement, that you still have health care coverage, because that's not what it's intended for. So I think that's one of those critical components that is missing. And it's a gap that we as healthcare providers, as social workers, care management teams need to, try to have those discussions. And then even us as children with parents and stuff, have those discussions with our parents early on, make sure that they understand it. So, that's critical. And then the Medicaid application itself is daunting. And so my first bit of advice is don't try to do it by yourself. Try to make sure as you're going through this, or as you feel like you're going to go through it, get all the paperwork you think you need together. Life insurance, annuities, retirement information, Social Security information. Gathering all of that is daunting in itself, and can take literally months to get everything compiled. And then from that, work with either, somebody within that long-term care facility. Usually there's somebody who is more of an expert than others, and spend the time really trying to make sure, because you want to make sure that you have the application accurate and completed to the best of your ability, because it can take months to get approval as well.
And also making sure that the facility that you're looking at accepts Medicaid, right? Because not all of them do.
Fair point. Yeah. And that is something that I did. But I mean, I've had conversations with several, colleagues and friends in the same situation, and they don't do that. There's organizations out there that will help you find a place for your parent or your loved one. But oftentimes they might be private and they may not accept Medicaid. And like I said, it's already challenging and not something for the faint of heart to move your caregiver from one facility to another. And so if you're going to go into that situation, you're almost better off trying to find some place that will accept Medicaid, because then they will work with you on that process, on that application process, when there's delays in getting that payment or getting that approval in. Those beds are short in supply too. So you might have some place that has vacancies, but they'll say they don't have a vacancy for a Medicaid bed. So planning that will help, I think, with a lot of stress as well.
When do you start planning for this? Because it's not when it's time, right?
There's not an easy answer, because you've got to know your parents a little bit as well, right? And a lot of that generation, at least like with my mother, she was very private about her finances and her health, and until it was almost too late, right, to really have those discussions. I think certainly if it can't happen sooner, if you have parents who are open-minded, more realistic, and can have those really hard conversations, then have them sooner rather than later, when they're retiring even, making those plans. But at the last case, it should be if they start to exhibit any type of more chronic health conditions, and you're having to start accompanying them to doctor's visits or things like that, by then you should be having that conversation of what ifs. And that goes into even putting, not just power of attorney, but, healthcare directives and all of those conversations. The sooner and the better you have them in advance, the better you are as a family. And it will decrease any of that potential conflict when the decisions have to be made in the moment. Especially if you're not right there with them. I mean, my mother was 15 minutes away. I'd see her multiple times a week in general. But it did seem, we started noticing little things, word finding issues, not remembering, a family member's name, but knew the relationship. So we started tracking some of that. I think another bit of advice I'd give is also get to know their friends a little bit, because what was really surprising, all of her friends were nurses and caregivers as well. What was surprising was that after we started seeing signs and started having additional challenges, and I had her move in and I got to know her friends more, it was they had started seeing stuff sooner. There's a different relationship between her and her friends than us. And so they had started identifying and seeing things sooner, but didn't feel comfortable coming to me to say that. And so I think that's just it's a little bit of advice or a little bit of a tip to say they might be the ones who know it before you do if you're not there as often. So being a point of contact, having their information is important as well. So I think there's so many things to do and think about, but if you're not close, it's more challenging. And then to your point, Erica, is, if you've got a sibling who is right there and helping, be cognizant of the fact that you might need to take a vacation to go and sit and be that caregiver for a week and allow them their true vacation.
Any final words of wisdom before we close this out?
I think overall, find your happy moments, right? This is it's very personal. It's very hard to deal with. It's hard to lose the parent when you haven't actually lost the parent or the loved one. So find the happy moments. We mentioned my dog earlier, and my mother loves to see her granddogs still. So I take them out to the nursing home, and the rest of the people in the memory care absolutely love it. It's a social day for them. So there's still pieces of her there, and it comes out when you have those happy moments, and just cling to those. But definitely plan ahead and live in the moment while you can.
Yeah. Great advice. Great advice. I hear this a lot in the industry of you don't know how hard it is until you actually go through it yourself. We talk about best practices. We talk about all of the things that you should be doing for patients and how things should work. And then when you have to go through it, you realize it might not be so simple as following best practices. So I appreciate you sharing this story. I think it's going to resonate with a lot of people. It's clearly resonated with me here today. Dawn Crump, thank you so much for talking with me.
Thank you, Erica. Really appreciate the opportunity.